Hot flashes. Have you ever seen women fanning themselves and wonder what was going on? Well, today we're going to talk about hot flashes. If that sounds good to you, continue watching. Welcome back to my channel. I'm duPont. I'm a board-certified gynecologic oncologist, and I enjoy teaching women how to improve their lives and how to be healthy. Today we're going to talk about hot flashes. I started my journey in G1 oncology treating cancer patients, but then I realized cancer survivors had very different symptoms. And I wasn't taught in school how to care for the cancer survivor. So I really had to learn on my own. And one of the big symptoms that cancer survivors face was menopause. A lot of them went through menopause because they either had chemotherapy, radiation, or surgery that removed their ovaries earlier, and so they went through surgical menopause. Well, I didn't get a lot of training in how to treat menopausal patients, so I joined the Menopause Society. It used to be called the North American Menopause Society, but now it's just the Menopause Society, and I took their training and became a certified menopause practitioner. Originally, I just focused my practice on cancer patients, but as I got better in treating menopausal symptoms, patients who weren't cancer patients started to come to my office. And so I began to learn how to treat women. One thing that I have noticed is with menopause, the symptoms are very common, but the treatment is very individualized. No two patients will have the exact same treatment. So today we're going to talk about hot flushes, exactly what they are, and why do they happen? Well, menopause usually occurs around the age of 51. That's the average age. 2 years before the estrogen levels start to drop is when women start to have hot flushes. Now, we may have seen someone in your family or coworkers or, friends or family members who just all of a sudden just feel very warm. They feel flushed. Sometimes they start sweating. It happens very briefly and all of a sudden. That is a hot flash. We term hot flushes as vasomotor symptoms. That's kind of the doctor term for hot flash. And it's due to estrogen activity that has decreased over time. Now, there's estrogen receptors, there's alpha and beta receptors in the brain that are responsible for these vasomotor symptoms. Estrogen contributes to well-being, cognition, and mood, and declining estrogen again causes hot flushes. Hot flushes at night are usually termed night sweats, and this disruption of sleep can cause fatigue. So why do hot flushes occur? Well, there's a thermoregulatory area in the brain that controls kind of how we regulate the sensation of heat, and estrogen receptors are in that area, and the lack of estrogen does affect that region of the brain. The neurons in this area will swell and activate the thermoregulatory region, triggering a hot flush. This sensation can be treated with estrogen. There's a new medicine that just got FDA approved called Veozah that actually targets these receptors in the brain, and it's a non-hormonal medicine, and it is available if you aren't able to take estrogen. Well, how long do hot flushes last? Typically, hot flushes will start 2 years after the onset of estrogen deficiency. So a lot of times women don't know that their estrogen levels are declining until they start having hot flushes. They may notice vaginal dryness. They may notice that things are just kind of changing in their body. And usually this is the sign that they're getting into the perimenopausal state. This can last for 10 years or more. The average time for hot flashes is 7.4 years. 42% of women ages 60 to 65 will have hot flushes that affect their quality of life. 10 to 15% of women have very severe symptoms that require treatment. Studies have shown that Hispanic and African American women have worse symptoms, and studies have shown that Asian women have lower symptoms of hot flashes. Well, today we talked about hot flashes, and we kind of described what they are, where they start, and what causes them. If you want to watch more videos on the menopausal transition or perimenopause, please watch these videos next. Thank you.